from Tennessee is recognized.
I ask consent that the quorum call be vitiated.
Without objection.
I thank the leaders for allowing me to go ahead. I joined Senator McConnell in welcoming Reverend Austin. He's from Murfreesboro, Tennessee, just down the road from Nashville. He formerly worked here. As Senator McConnell said, we're delighted he has this privilege today to pray at the beginning of the Senate, something that has happened since the beginning of the Senate, since the very first days of the United States Senate. So thank you for taking your time to be here, and welcome. Mr. President, could you let me know when I've consumed 8 minutes?
Chair will do so.
Thank you. Mr. President, this is St. Patrick's Day, as Reverend Austin mentioned. We celebrate that. We're coming up on another important anniversary, and that is the anniversary of the enactment of the health care law, which the majority regards as an historic achievement and most Republicans regard as an historic mistake. I want to talk a little bit about that law, but there is another anniversary that I remember very well, and it came a few days before the enactment of the health care law, and it was the so-called Health Care Summit that was held at the Blair House. It was a remarkable event. The President of the United States, highly intelligent, well-versed on health care, invited a bunch of us down to discuss health care, and he stayed, and we stayed 6 or 7 hours. During that discussion, it was a pretty free exchange. I especially remember one event. I'd been asked by Senator McConnell and Representative Boehner to represent Republicans in presenting our side of it, and actually the President's invitation gave us a platform we usually don't have. He has a better platform than we do most of the time. So we made our argument that we would prefer an approach on health care that instead of expanding a health care delivery system that we all know costs too much, that we should instead go step by step to reduce the cost of health care so more people can afford to buy insurance. That was the basic discussion we were having. But then we got down to some facts, and I had said that according to the Congressional Budget Office, the President's plan would raise individual premiums, make insurance costs more for individuals who buy insurance by 14 to 20%. The President said, after I had finished, "So Lamar, when you mentioned earlier that you said premiums go up, that's just not the case, according to the Congressional Budget Office." I said, "Mr. President, if you're going to contradict me, I ought to have a chance to respond. The Congressional Budget Office says the premiums will rise in the individual market as a result of the Senate bill." The President said, "No, no, no, no. Let me," and this is an example of where we need to get our facts straight. I said, "Mr. President, that's my point," and it went on from there. I had to make a decision at that moment. I see the leaders may have. I had to make a decision at that moment whether I should continue to have a public disagreement with the President, and I decided that while I thought I was right, just as he thought he was right, that it would be more appropriate for me not to do that in public, to let other senators and congressmen have their say. And so I exchanged a letter with the President that day, and then I came to the floor of the Senate later that day to make my argument why I believed premiums would go up. And Mr. President, I would like to ask consent to include in the record the transcript of my exchange with the President and that of Senator Kyle and a couple of members of Congress. The letter that I sent.
Without objection.
The letter that I sent to the President that day, or really handed to him, making my point rather than publicly argue with him. And finally, the remarks that I made on the floor of the Senate later that day. Now, we talk a lot about the law of unintended consequences in dealing with legislation. In this case, I believe the health care law is a situation where we had a lot of predictable consequences. Republicans were saying, for example, premiums are going to rise, and in fact they have. We were saying specifically that individual premiums will rise, and it was predictable that they would, because in the first place, the health care law requires that you buy a better policy if you buy a policy. So if you're going to buy a Cadillac instead of a Chevy, it's going to cost more. You're going to get more benefits. Second, there's some taxes in the health care law, and such as with medical devices, they're passed on to the consumer, your premiums go up. Third, a lot of the people who moved into Medicaid are going into a system of government health care where the doctors aren't properly reimbursed. So many of these doctors shift some of their costs over to the people who buy insurance. That's called cost shifting. So for all those reasons, we've seen stories regularly in California, Nevada, Wisconsin, Connecticut, that individual premiums over the last year have gone up. And let's look at some of the other things that we talked about during that time. We said the bill would raise taxes. In fact, it does, $813 billion. And as I mentioned, the tax on medical devices, that's passed right along to insurers, to people who buy insurance. Their costs go up. We said it would cut Medicare. In fact, it has. 11 million Medicare Advantage recipients, that's about 1/4 of everyone who has Medicare, are seeing or will see their benefits reduced. We said there'd be thousands of pages of new regulations that would hamper small businesses and individuals as they go about their daily life. We're beginning to see them come. The most notorious is that Form 199, 1099, which causes 40 million businesses to file a report every time they buy something that costs more than $600. We hear a lot of talk about repealing that. We've tried to repeal it for some time, but it's still the law. One thing that particularly bothered me about the debate were the unfunded mandates on state governments. We see about college tuitions going up in California, 30, 40%. People would be surprised to think that the reason may be because the federal government is imposing more health care costs on the state of California, and the money that ought to go for the University of California or Tennessee isn't there. So where does the university get the money to keep its excellence? It raises tuition. Our former Democratic governor, who just retired, said that the health care law imposes on Tennessee more than $1 billion in new costs between 2014 and 2019. That's an unfunded mandate from Washington that will cost the people of Tennessee. Fewer jobs will be created as a result of this law. Now, someone might say, well, how can you say that? I'll give you an example. I met with a group of leaders of the restaurant industry in America. They're the CEOs of all of the big restaurant companies. They're the second largest employer in America. They hire a lot of low-income people. One of them said that they had been operating their stores with 90 employees on the average, and as a result of the health care law, their goal was to operate it with 70 employees. That's fewer jobs. And there were many other examples of that around the room. Even the student loan takeover has created a problem because students are actually paying more in interest on their student loans to help pay for the new health care law, which I think a lot of students wouldn't appreciate. So the health care law that was passed a year ago, which some believe is an historic achievement, we believe is a historic mistake. We believe it would have been better and would be better to, instead of expanding a health care system that costs too much, that we go step by step to reduce its costs so more people can afford insurance. And so we'll continue to advocate that. We voted to repeal the health care law. We lost that vote. But we're continuing to work, Senator Johan's leadership and others. Thank you. Senator Johan's leadership and others will work to repeal the 1099 provision. Senator Hatch and others are working to give governors more flexibility in the Medicaid program. And we'll continue to advocate solutions like allowing people to buy insurance across state lines. So next Wednesday is an important anniversary. Some believe it's an historic achievement. We believe it's a historic mistake and that there's a better solution to health care costs. I thank the President. I thank the leader for his courtesy and giving me a chance to go ahead. I yield the floor.
Mr. President.
Majority Leader is recognized.
When I was a little boy growing up, we used to have chickens, and every morning, the roosters we had, they would make the most noise, unbelievable noise they would make.